what is the role of nutrition in the development of asthma and allergies, and what role does food insecurity play?
We've been discussing sort of modifiable risk factors and nutrition, looking at nutrition and nutrient intake presents an opportunity to sort of see, what are you putting in your body and how can that potentially affect development of asthma or asthma outcomes. And so if we look at the data for asthma, we do see, for example, studies on vitamin D, and we know that vitamin D is immune modulatory, meaning that it affects the immune system. It can be antibacterial, antiviral, anti-inflammatory. And we know that asthma is a lot of inflammation, and so because of those properties, and because many Americans are um, deficient in vitamin D or have low vitamin D levels, we do see, a signal or some evidence to suggest that, repleting your vitamin D level can help reduce the risk of exacerbations, especially those triggered, from infections. And so, and perhaps it's mild to moderate asthma. We have less data on severe asthma, and that's, sort of one example in that fields or body of evidence is still sort of evolving. And then we can look at other things. Some colleagues and I wrote a paper about 3 years ago, published in the ATS Annals, about sugar sweetened beverage intake and development of asthma. And so we looked at in our cohort, the Project Viva cohort in Eastern Mass, of pregnant women and then their children, and followed them. And we saw that increased sugar sweetened beverage intake during pregnancy, and then also those children then in early life, about age 2 or 3, having increased sugar sweetened beverage intake correlated with greater odds of developing asthma. So I think that this is an area in which we really need to sort of do more investigation, and it's likely a balance of, sort of having more intake of antioxidants and vitamin D. And you can think of antioxidants as sort of fighting that oxidative stress. Think about eating the whole rainbow of fruits and vegetables, and then trying to minimize your intake of things that can be inflammatory, such as, sugar. And we see a lot of data for, in diabetes and heart disease and fatty liver disease, that, sugar does have harmful inflammatory effects. And so we need to investigate this more, and it ties directly to that, structural racism and social determinants of health, because access to food, access to healthy foods, in many communities of color and low income communities, there's a lack of access to healthy foods, and grocery stores that would have a wide variety of fruits and vegetables. And so we need to take all of this into consideration where we're developing, policies and doing city planning. And so there's also, a role in food allergies, and the role of food intake. But I'll let Dr. Louisias talk a little bit more about that.
Thanks for that, Dr. Wright. And I think, what you're alluding to with the idea of the food deserts, I mean, really, again, ties in nicely into the issue of food insecurity, because I think it's an area that's also really under-recognized in food allergy, and, when you think, well, just to define it for the group, food insecurity is really a household's inability to provide enough food for everyone to be healthy and to have adequate nutrition. And in terms of the scope of the issue, like before the COVID-19 pandemic, it was thought about like 10% of households actually had food insecurity. And now with the COVID pandemic, with people losing their jobs or being like underemployed, it's about 25% of households. And then when you break it down by race, like, again, looking at those health disparities, Black and Latinx populations are 2 times that of white population. And so if you can imagine that now you have a condition like food allergies, where the gold standard, unfortunately, right now for treatment is avoiding foods. And then you combine that with food insecurity, where you don't have access to enough nutritious foods, to be healthy. I mean, this naturally is going to end up leading to a disastrous situation. And so I think the idea right now is that, what ends up happening when you have the intersection of these two issues, what these families are seeing is that these families with food insecurity, they're having access to food pantries, where these food pantries are not even knowledgeable in food allergies, right? Or if they're on public assistance and receiving, WIC or SNAP benefits, they may not be able to get the different types of, safe food allergen friendly foods, or they may not even get it in the appropriate quantity. Like if that food is available, on their public assistance plan at a certain size, if they find it in a different size, they can't even get that food. And so I think one of the papers that I thought that really highlighted this intersection, and really there's frankly a dearth of literature, but there was like one paper that I saw that came out at Arkansas Children's Hospital, where they looked at their food allergy patients and asked the question, how many of you are actually experiencing food insecurity? And they saw about 20%. 20% of their patients experience this. And I think, for those of us who are allergists in the group, or even for our food allergy patients watching, I mean, have you been asked that question if you've experienced difficulty, getting food? And I think we're not doing a good job of, assessing that. And I think really, thinking about, at the end of the day, with the goal of this panel, thinking about solutions. I mean, I think the one thing is increasing awareness. Like if we don't ask the question, we're not going to know that it's a problem, right? And then I think another thing just to put on the table in terms of an actual action item is looking at, WIC, for example, and having them, reduce brand and size restrictions on the type of WIC allowable foods, and really having that being accessible to states. And I think another organization that some of our viewers could look into that does a lot of great work in this area is the Food Equality Initiative. So they do a lot of great work, and I think they should be definitely further supported.